Like other healthcare systems, we've had people just leave healthcare. We've had nurses go into travel contracts. And so for us, we describe both the direct and indirect effects of the COVID pandemic. So the direct effects, how many of our beds were filled with patients that had COVID-19 and how sick were they? That was in its own right a thing to deal with, right? But then we also had skilled nursing facilities shut down because of COVID-19, staffing crises both here and in our mental health hospitals and in our skilled facilities. We had staff that were tired. And so the indirect effect of COVID is tremendous and hard to measure because there are people that were lonely for 2 years in the COVID pandemic, and that makes your mental illness worse. That can make your physical illness worse.
So on our arrival, I could definitely tell that the University of Utah system had a number of staff who were overwhelmed. They were burnt out. They couldn't call in sick. Having the opportunity to come here and augment and integrate with the local system gave them the opportunity to do things like have planned days off and actually be off during those days. Besides the brown t-shirt or perhaps the haircut that I wear, there's absolutely no way to tell myself or any other member of my team from any other member of the post-hospital staff.
So where we are now is we have gotten through about a quarter of our surgical backlog. And so since it took us about 2 years to get to that, the fact that we've cleared that much in the 3 weeks the Navy's really been here and clinically supporting us is huge. Our ED wait times are tremendously lower. So we don't have patients waiting for hours and hours and hours to get a clinical bed now. They usually get checked in, the decision to admit is made, and then they're able to go upstairs to an inpatient bed. We did not call a backup physician this month for the hospitalist. And then we haven't called a patient and asked them to reschedule their surgery for the majority of the last few weeks. For us, it is a recovery team. It was the bridge to help us get out of Omicron and in a position where we can take good care of our patients moving forward. And I am not sure how we would have done that without them.